Welcome, everybody, to the
Hi.
community forum for the Academy for Addiction and Mental Health Nutrition. I am so glad you're all here. We actually have 44 people signed up, so we're going to wait a few minutes to, to give everybody a chance to come on. And then I'm delighted to turn this over to Carla Bate, who will lead us in a fascinating conversation on amino acid and nutrient therapy for supporting people in coming off pharmaceuticals. While we are waiting for people to come, let's just do whatever introductions we can fit in over the next couple of minutes, and then we will just jump in. So if you could just do a very quick one sentence introduction, who you are, very briefly what you do, and where you live. Lori.
Lori Gagan, Utah, brain certified health coach with Dr. Amen from Amen Clinics and certified with Christina in her level 1 amino acid therapy.
Welcome. Lori Germain.
Hi, I'm Lori Germain. I'm here from Vancouver Island in Canada, certified with Christina for level 1. Basically working on just getting my practice going and treating people basically with food and the basic aminos support.
And writing a book.
And writing my book. Yes, thank you.
Excellent. Jules Wicker.
Okay. Uh-oh. Am I on? Yes? Okay. Hey everyone. I've completed years ago, I think it was 2022, the level 1, level 2, and just getting my business going, Catalyst Coaching, for mood and behavior, about 10 years, just got 10 years sober myself and love to move through the decade and love to move through. I work for 3
What
different.
are you doing?
What am I
Why are you
doing?
looking at me?
We'll get there. We'll get there.
Why are you?
Let's do introductions right now.
And I just work for a couple different recovery centers as a nutritional wellness educator.
Welcome, Jules. Rochelle.
Rochelle Bachran. I am a retired health educator. Right now I'm in Denver, Colorado. I travel a great deal. I am the parent of adult children who have struggled in their lifetime, and I am an avid learner and a student of Christina's. Thank you.
Welcome, Rochelle. Elena.
Hey, good morning. Hi, Elena Holt. I'm in Sacramento County, certified nutrition educator and Christina's level 1 certification. And I work online and in person with people with alcohol and drug issues and food, and clean and sober for 19 years in a row.
Congratulations and welcome, Elena. John Umhout.
Hi, nice to be here, everybody. I'm a physician and I have a specialty practice treating alcoholism.
Glad to have you here. Fawn. Unmute.
There we go. I'm Fawn Kretschmann. I'm a psychiatric nurse practitioner. I learned of Christina, and I'm hoping to be able to really take advantage of her training soon.
Glad you're here. Rika.
Hello, I'm from Europe, Finland, and my name is Riikka Haikonen, and my dad was an alcoholic, so I'm a nutritional therapist, and I would like to learn more about this.
So glad you're here. Welcome.
Thank you.
Well, it's 5 after, so let's jump in. And I will let Carla give her, a little more of an introduction, but she is a very highly trained nutritionist in many different ways, and I'm excited to hear what she has to say. Carla. And we cannot hear you. You're unmuted, but we can't hear you. Nope. Do you want to go out and come back in again? Okay. So we'll keep doing introductions then, because it's a wonderful opportunity to get to know each other. Michelle.
Hi, everybody. My name is Michelle Solis. I'm in San Francisco. I used to be a client of Julia Ross almost 13 years ago, and she changed the course of my recovery. I have 12 years and 9 months clean and sober, and it was only because of the nutritional therapy that it changed the course of my recovery. And now I'm grateful to say thank you. I finished my master's program waiting for my credential for AMFT, but I am also currently working with Julia and her team on the certification for nutrition therapy. So I work in recovery as well, part-time at Olaf, where Julia also used to work in the 80s, helping people in recovery
Wonderful.
with nutrition. Thank you.
Thank you, Michelle, and I'm so glad you're here. Okay, Carla, let's try you again. Okay, what we're going to have to do is you are going to call me, and we're going to have your audio through my phone. Because we don't know what's wrong, but that's okay. There's always a plan B.
Good morning, Christina. This is Mara. Carla can always call in herself for her own audio to the program through the phone.
Okay, we're here.
Okay.
Can everybody hear her?
This is so weird. It says that, oh gosh, now there's a feedback.
I'm going to mute you. I'm going to mute you.
Okay. So, okay, well, I hear myself, like after I speak, it's a little distracting. I'm going to I have a microphone in the room. I'm thinking maybe if I try plugging that in.
Okay, great.
Let me just grab it. I don't know what's going on.
Lisa, why don't you introduce yourself briefly? Lisa Hill?
Yes. Hello. So I'm Lisa Hill. Hi to everyone that I know. I'm Jules, Rochelle, Elena. Hello. And Christina. So I'm a level 2 graduate and have my own practice and use neurofeedback and aminos and nutrition and all the things. And I'm excited about this conversation. Sorry, I joined a little bit late. Want to see some other tools. I've successfully weaned some of my clients from their psych meds and want to see some other tools because I have a kind of a challenging case right now. So happy to be here. I've known Christina for I think about 3 years now. So happy to have found her in the academy. Thanks.
Glad you're here.
Thank you.
All right, Carla, let's try you again.
Can you hear me now?
Yes.
Okay. Wonderful. Thank goodness. Okay. Hi, everybody. My name is Carla Bate. I'm so excited to be here. Thank you for having me, Christina. So I took Christina's level 1 and 2, I don't even know, 2022, 2023, right after I completed my master's in clinical nutrition. When I was still in my master's program, you study everything, like cardiovascular, kidney health, surgery, just like nutrition for everything, right? Everything in the medical world. And when I was learning about neurotransmitters and amino acid therapy, I just thought that was the most interesting thing, that you could shift your moods using nutrients, and just learning about kind of the universal symptoms of, low serotonin being this guilt type of depression kind of helped me make sense of a lot of my previous life experiences. Earlier in my 20s, I grew up in Hollywood. I was a big partier, and I was like, oh, I was just blowing out my serotonin and my dopamine, and it makes sense that I felt that way. And so I told my teacher in my school that I wanted to, study amino acid or use amino acid therapy. We were given the opportunity to work on a real client at the end of my program, and she wanted to get off an antidepressant, a sleeping pill, an Adderall. And I went to my teacher and I was like, what do I do? We had studied it for a week, right? And she was like, you cannot do this. You need to go study more. And so she referred me to Christina, which I'm forever grateful for. And the irony was, or the kismet was, that I was living at home at the time. I had moved home, and just after a breakup, finishing school. And my brother had also just moved home. He had finished medical school in Europe. And we were confronted with the fact that my brother had, been on this very intense 16-year psychotropic medication dependency cycle or trap, had ended up in the psych ward from an SSRI, had a really horrible opiate addiction, had a horrible benzo addiction. And I was learning everything with Christina, and just like had this really interesting case right in front of me. And so I basically started to use him as my guinea pig. We built up his nutrients. He chose a date to stop, doing opiates. And through the amino acid therapy, working on him, he described that withdrawal as a cakewalk off of fentanyl, which is the most addictive substance on the planet. And I'm not saying that was like the end of his journey, it was a up and down after that. But just witnessing that was so profound, and obviously using it on myself and my mom at the time, because we were all really stressed out. I was like, wow, this is what I want to do, but I don't want to necessarily work with people in addiction. That seems really hard. So I kept having clients come to me who wanted to get off psych meds, and I just thought it was so interesting that you could, I learned, the protocols from Christina. I was like, I want to dive into this. So I started my practice, and I have a program called The Liberated Life, From Pharma to Freedom. And I basically have been working over the years to build my practice or expand my practice, and also, streamline the process as much as possible. And so I'm also so excited to hear from all of you on what you're finding works, and the best way to do this. But basically I've found, like you would do with someone on any other kind of drug, I think it's really important to have a prep phase. And I used to try to skip this part, especially if clients were really struggling, but now, and I still sometimes might start a little sooner with theanine, but I really try to make sure that there is someone is unmuted. It's a little bit of background sound, but try to make sure there's like a 4-week prep phase. So I will work with someone, get all of their intake, have them do all the forms, but then really build up their nutrient status for the first 4 weeks, get them on therapeutic doses of vitamin C, magnesium, zinc, Bs, look at their digestion, look at their diet. I've recently gotten really into the work of Dr. William Walsh. And so I'm starting to bring in a lot of, looking at what could their depression biotype be, because I think, the ultimate goal is not only to have a successful transition off the medication, but for them to not feel like they are trapped on the medication merry-go-round forever. So to really be able to restore their nutrient status so that they're not suffering from anxiousness or the blues, and feel like, okay, I'm off the med, this is okay, because I'm still depressed. So that's been a lot of fun working with kind of, what's your depression biotype and what can we bring in perhaps, after we've done the amino acid therapy, like some SAMI or if they're need methylation support or whatever it may be. But so then, after that first 4 weeks, I basically start, and I will say the most pressing nutritional pattern that I see is the need for serotonin support. So we usually start there, and then we'll kind of just layer and continue over, the following weeks, trialing the other amino acids. I think the balance is really to be able to stack one small win at a time so that they can implement the protocols, have the opportunity to see the effects and not be overwhelmed, because it's a lot of supplements, right? And one thing I really wanted to open up this conversation to is your guys' thoughts, because this is something I struggle with. Like, I think about a lot. Like, I think right when I completed your course, Christina, that huge meta-analysis, I think it was a meta-analysis, came out where it's like, okay, we've disproven the low serotonin theory, right? And so I feel like sometimes that has the potential to not discredit, but like we have to explain that to people, right? And it's like, okay, the way I've kind of reconciled it is there's not like some inherent defect with you and you just have low serotonin. It's like we need to look at the whole story and all of the nutrients that come into play for serotonin production. And then also, of course, it's most likely not going to be only serotonin. And so that's where what we do comes into play as well, and is really different, looking at all of the nutrient deficiencies. And also, like, again, yeah, just calling it what it is. It's about nutrient deficiencies and imbalances, and not necessarily like you have this inherent defect that is stagnant and just the way it is. So yeah, I'd love to, I don't know if it's like too early to open up that conversation, but really, I guess I will continue and kind of just explain how the rest of my program works. Also, I'll have people come to me.
Carla.
Yeah.
So please go on with the rest of your program. And then I think that will be an excellent discussion. And the other discussion I want to open up is the experience of myself and so many of my students, that the people on the largest number of psychotropic medication are generally the ones who are eating the most highly processed foods and have the lowest nutrient status. So let us, and that may not be true with certain populations, but in general, I have certainly found that to be very true. So that'll be part of our conversation, but I'd love to hear your protocol and maybe one or two case studies.
Sure. So just thinking about diet, I will say, I think most of the people that find me and are interested in this stuff and willing and able to invest in a 6-month program like this are pretty conscientious of their diet and have tried a lot of different things by the time they find me, whether that's eliminating gluten or, dabbling with keto, or they're eating quote unquote healthy for the most part. I just lost my train of thoughts. Oh, I was going to talk about, I think the two main populations that come to me are they're like, okay, I really don't want to be trapped on this medication. And, I've done the research and I get, I've been on this medication for 3 years or 5 years or 30 years. And I get that this is something that no one ever told me, that I just have to be on this medication forever. There's, withdrawals if you get off, and it's pretty crazy. Every single person I talk to, and I talk to hundreds and hundreds of people, because even if people don't end up working with me, I'm having conversations with them, and their doctors are like, oh yeah, you can just, reduce in half for 2 weeks. And then after that, go to every day for 2 weeks and then just stop. It's like insane, the amount of people who their doctors seem to have no idea about the damage these meds can do. And they're completely uneducated. And it's pretty scary. I mean, people who have ended up in the psych ward before they met me trying to go off their meds, you name it. But yeah, I'll give a couple case studies of like the two different types of people that mainly find me. The first one is people who just are educated and they're like, I want to do this right. I want to go off my psych med right. And so they're still on their medication, right? So for example, I met a woman named Kathy. I'm just kind of looking for her story. She came to me saying, you know, I want to feel more like myself. I have these crazy mood swings with anxiety. And she was on 4 different medications and she still felt really, really off balance. She was on Lunesta for sleep, Xanax for anxiety, Lexapro, and Wellbutrin. So 4 different medications. And she wasn't even functioning well. She wasn't even feeling close to stable. She was doing everything right. Like she was working out 5 days a week. She was doing breath work. She was doing yoga. She was sleeping 9 hours a night. She stopped drinking years before. She was really healthy, but she was still struggling with these really intense mood swings. So one day she'd feel amazing. The next day it was like doom and gloom. And some days she was just completely apathetic, like she didn't want to get out of bed. So kind of the whole scope, right? And it was really affecting her work because she had her own business. She was online, client facing every day. And then she'd also gained 20 pounds. And she couldn't lose it despite, you know, being keto and consistent with her diet. And she just felt really uncomfortable in her skin and wanted to feel like herself again. So we worked, you know, in addition to digestive enzymes, we put her on a probiotic protocol because she had a history of parasite and E. coli infection. She had already done the parasite protocol, but yeah, we really just focused on, in addition to the amino acids, supporting her brain chemistry or supporting her digestive health and her gut. And so basically we had her on the foundational.
Carla, sorry, sorry, I think you said amino acids by mistake. Okay, so you're working on her digestion. Go on.
Yeah. And so with the clients that come to me that want to taper, you know, I say my clients have the most success when they do the prep phase for 4 weeks first, when we build up their nutritional status. And I always think of you, Christina, because I'm like, I'm not a doctor. I can't make medication reduction recommendations, but what I can do is tell you what's worked for most of my clients. And so they do 10% at a time, whether it's every 2 weeks, eventually, maybe sometimes it's every week. And I really encourage them to let their reduction be symptom led and the way that they're feeling when they do reduce, as opposed to obsessing on the timeline or the taper amount. I think, you know, the most important thing is to be feeding their brain. And so really getting them to be like, okay, I did that reduction and I'm feeling a little irritable. And that's what happened to this woman, Kathy. And so she would just, you know, what do I do? This is the time of day I'm feeling it. I was like, yeah, you can bring in more 5-HTP then. And basically just nip any.
Excuse me, Carla, which medication did she start tapering off first?
Good question. She had not been on the Wellbutrin for very long. So I think that was one of the first ones, but within the first 7 weeks of us working together, she was off of her Lunesta, Xanax, and Wellbutrin completely, which was really profound. Impressive. But she had been on keto and she had been really invested in it. And so with her diet, what I did with the keto was just bring in some feast days to kind of give some diet variation. So her body wouldn't be like stressed out on keto for months and months. So we would bring in, you know, a feast day and then a fast day the next day. And that kind of just helped kickstart the benefits of the keto, right? And then so the Lexapro is what she had been on the longest. And so we really took time with that. She actually took, you know, we just finished 6 months together. I think she's 8 months and she's, no, she finished after 6 months. Yeah. But she, you know, told me after just 8 weeks on the amino acid therapy, she's like, I looked at my husband and I was like, we have so much to be grateful for. Like she had done a complete 180 and really, she is like a lot of my clients with the amino acid therapy and done very cautiously the taper, you know, they're able to kind of, maybe they have one day or one, bad moment, and they're able to really reach for the aminos and have them make them feel better quite quickly, which is pretty amazing. She lost the 20 pounds as well. And then, the second kind of client I'll have is my client Delwyn. She basically had cold turkeyed, or essentially almost cold turkeyed. She had gone down really, really quickly of like the highest dose of Effexor that you can be on. And so she was really struggling. She was having brain zaps. She was just like described her anxiety of 10 out of 10. Her family was walking on eggshells around her. And so, and she also had tried everything, vitamins, minerals, working on her sleep, just all the usual stuff. And she just felt like she could not like get off the floor. So, again, in 7 weeks, she was feeling a lot better. I think for her, what really helped was theanine and GABA. This was a while ago, but yeah, I mean, it's pretty amazing just to see people, like I said, after 7 weeks, learn the toolkit, right? That they have this, what I call the good mood medicine cabinet that they can reach for, just being able to identify what they're feeling and being like, okay, this is what I need, and getting that instant relief once that foundation is built of, getting them to eat protein every 3 to 4 hours, getting them on whole foods, working on their digestion.
So Carla, how did you use the amino acid therapy chart through the process with these two clients?
Yes. So I will say I'm starting to use it more often as I scale, but I will say I did not use it super often in the beginning. I think just I was really able to tap into with them because I was meeting with them every week. So I would have a really good sense of where they are just intuitively. But now as I'm scaling my business, I'm going to have clients fill it out. It's going to be like automatically sent to them every week. But that's a good question. And like the new system I'm using is going to track all of their responses in one document. So we can look
Nice.
at like automatically. Yeah.
So it sounds like, I mean, when I talk about the amino acid therapy chart, it's simply written down on paper, the questions we ask our clients, from our heads as to what their mood and behavior is at any particular moment. And so, the amino acid therapy chart is just a tracking tool. But if you know what questions to ask during the therapeutic interview, those boxes get checked off anyway. So it sounds like that's what you were doing.
Yeah, exactly. Yeah, it's funny. It's like once you know this stuff, you can't unknow it. Like even
That's right.
people close in your life or whatever the craving or the mood, you're like, oh, and you don't want to always say it, right? Because they didn't pay you to be your client, but like, oh, they need some serotonin support.
Well, I remember how we um, detoxed your brother off his fentanyl and then later supported his detox off his benzodiazepines. And, we did it step by step and did a lot of symptom management using the various nutrients and the aminos. It was really quite a powerful process.
Yeah, I think the best way I always explain this process is it's a lot of if this, then that.
Yeah.
And I think, the art of it is about being able to prioritize which neurotransmitter system to work on first, merely because you want to know what's working, obviously. And then also you don't want to overwhelm people with like, you have to take, these 16 supplements a day. And then I think, once what I'll do is I'll work through one at a time with someone over, it might be 2 weeks that they will master their 5-HTP protocol, and then we'll layer in GABA and kind of just prioritize, is it sleep that they really need? If they're only sleeping like 4 hours a week, we'll go there first. But then they'll get to a point where they're just stacking in one new protocol at a time so that they've got their schedule, right? Like I take my 5-HTP at this time, I take my tyrosine at this time. With GABA, I usually bring it in later. I would say at least 8 weeks after they're on the foundational cofactor support and anti-inflammatory, higher, not high protein, but protein every 3 to 4 hours diet because of that B6 and zinc. I want that to be built up. And that's just because I've had bad experiences trying to rush that. So now I just kind of, because people coming off psych meds are more mentally delicate population, I just try to be super cautious with all of the if this, then that.
Mhm. Well, and that brings me to the research that's been done that so many of these psych meds, especially your SSRIs, significantly deplete us of our cofactor nutrients, that they are a nutrient drain in and of themselves. And so I really like your spending the first several weeks building up their nutrient status using, I'm assuming the multivitamin and the fish oil and the diet, and getting those replacing the nutrients that were either drained by the medication theoretically or drained by a not useful lifestyle.
Yeah, and all the stress that they're under, for sure.
Mm-hmm. Mm-hmm. Well, let's open this up now to questions and discussion. And then we'll come back around to the 2 questions that I posed. But who else has questions or comments?
Christina, this is Lori. I have a question on our protocol.
Yes.
So are you free forming your amino acids, or are you just having them take the supplement, swallowing them with water?
Do you mean sublingual by freeform?
Yeah, like if they're in a capsule format, you have them open and then put it under their tongue for like 20 seconds or so and then swish with water.
Yes, yeah, I do, especially in the beginning. Not with DPA because it's so bitter, and not with tryptophan because it's so chunky and I found it doesn't really dissolve very well. So I think what I found is just making sure that you take the tryptophan with a carb, and
Okay.
that seems to work. I will tell my clients, after once they find their dose through the trialing, that they can go to swallowing, but we kind of talk it through, and some of them are like, I don't mind, for the 5-HTP and the tyrosine, since those ones are kind of fairly absorbable and the taste is mellow. GABA is obviously really absorbable and the taste is mellow too, but I feel like that one is one that works really well to be easily to go to swallowing after they find their dose.
Okay, and then I just have a follow-up question. So when you're working, we'll say your brother, for example, have you ever with any of your clients who you're coaching, look at their DNA just to see if they have bad serotonin receptors, or genetics, the 5-HTTPR or whatever it is, to see if they have a problem with that when you're dosing 5-HTP serotonin type supplements. And I'm just curious because I did it on myself and I did it on my son after we did the Dr. Amen brain specs, which kind of was a piece of the puzzle I think I was missing. Not everybody obviously can afford it, but I could definitely see that there was a link with serotonin deficiencies based on genetic. And I didn't know if you've ever done that with any of your clients.
I have not, and I would love to know who you did it with. I just find personally when people are looking for quick relief, sometimes it doesn't, they don't want to wait for labs. I also don't have a lot of experience in that. With genetics in general, I also try to, and I don't know how you feel about this, Christina, but I try to really put the emphasis on epigenetics. It's like, just because you have this genetic variation, you have no idea if it's expressing or not. So let's work on the things that impact your lifestyle, your genetics, your lifestyle, your diet. Are you getting methylated Bs? Are you detoxing? Can your nutrients actually get into your cells? And not get too hung up on the testing because they want quick relief.
See, I'm with you there, Carla. And I have done, I mean, not a ton of genetic testing with my clients, but I have certainly done some. And, you know, when you were saying that there's no like inborn, you know, serotonin thing, well, there may actually be some inborn genetic blockages in some of these pathways that support neurotransmission, you know, across the four neurotransmitter pathways, as well as other parts of the brain or brain functioning. And so, you know, we have reward deficiency syndrome and his 10 SNPs, and we have, you know, a whole bunch of other SNPs that certainly impact mental health. You know, Dr. Walsh just came out with his new book looking at the SNPs that impact ion channel regulation for people with bipolar disorder and how he thinks he's found the switching mechanism. So that's fascinating. So, yes, genetics can certainly show us what are some of the possible underlying drivers if, of course, those genes are being expressed. So this is why I like using the chart and a good history to know how the genetics are actually being expressed in real life. But bottom line, it kind of doesn't matter because 80% of the time, the amino acids are still going to work to offset the impact of the genetic variants. And, you know, Dr. Blum identified in the 70s and 80s that 10 months on tyrosine can upregulate your DRD2, you know, receptors, can upregulate the it actually has a epigenetic impact on the number of receptors that are being expressed. So, you know, it's not written in stone.
Yeah, and I'm toying with the idea of making my program a little more expensive and including labs from DHEA, or right at this point, I just say I'll review any recent labs you have in the last 45 days, and if you can get me new labs if you don't have them, that'd be great. Or if you next time you're doing labs, please include whole blood histamine, plasma zinc, serum copper, serum ceruloplasmin, homocysteine, and, you know, the inflammatory markers, in addition to a full thyroid panel and a couple other things like liver marker function. But
and I do that as a standard, of course. I always ask my clients for whatever their recent labs are so that I can see those things.
yeah, I've
And
been
if I'll,
reading this book, Nutrient Power
Mhm.
by William Walsh. So I'm getting, that's kind of, I feel like my next immersion in all of this stuff. Like I'm really nerding out deep in all of that right now.
No, he's fascinating. I don't agree with all of his practical conclusions. I've been watching his work for, you know, 10, 15 years, and sometimes it's spot on and sometimes it's not. So that's interesting. But what are other questions or comments or experiences in using nutrient therapy in supporting people off their meds?
I want to just ask about the prep phase, and I love that idea, but can you give a general view? I know it's going to differ from client to client, but what would some of the top nutrients, I know you know, magnesium, zinc, and certain Bs, that's my first part of the question. And then I do want to know, because I've had a recent experience about brands. I used to use like one particular brand of the lithium, and then I switched to pure encapsulation. And wow, has it made an impact? So if there's certain brand companies you find are more efficient and effective.
Yeah, I use Fullscript. So I use brands that I personally tried and that I like, especially when it comes to the amino acids, as far as like consistency, dissolvability for the trialing, the flavor. I will put someone on a multivitamin, vitamin C. I can show you guys an example. Can I share my screen?
Absolutely. Yeah, we'd love to know what the two clients you mentioned, what initial protocols you put them on.
Oh gosh. So the first one, Kathy, she was kind of like one of those dream clients. She was referred to me by a nurse practitioner. So she was on a lot of things and kind of was like open to any additional recommendation. So she was a fun one. I can pull that up in a second, but here's an example of a prep phase for a woman. And I'll always give them the reasoning so that, I think that just helps with compliance, for lack of a better
It
word.
sure does.
Vitamin C, multivitamin C, I'll have them take, 1,000 milligrams AM and PM. So this will be with breakfast or lunch, first meal of the day. Sometimes digestive enzymes are on here just because of after speaking to this client, it became clear that she could use that support. Sometimes I'll add rhodiola, the adaptogen, and I'll do that twice a day, 30 minutes before meals. I think it's 400 milligrams each time. I'd have to look, and I have a paper on that too if anyone wants. Can always email me. But yeah, so zinc, I think this is I usually put people on 30 milligrams, and sometimes that'll be once a day. Sometimes that'll be, 30 milligrams. If I have a client that we suspect pyroluria, or obviously we've tested for pyroluria, we'll go higher. I like, so these are brands that I like, Pure Encapsulations. I like Thorne. I like Designs for Health. This is a client in Canada. So there's kind of some brands I'm not as familiar with that I just found on FullScript. Sometimes I'll put them on, Seraphos, phosphatidylserine. This client did not want to take fish oil, and so I put her on the phosphatidylserine, or sometimes I'll put them on phosphatidylcholine, which is, those healthy fats, and then just encourage that they eat omega-3 rich fish at least twice or 3 times a week. Things like mackerel and salmon and anchovies and sardines. But that's kind of another rabbit hole we could go down, Christina, about like the population. And I think it's pretty niche, but who are saying that like all fish oil is inflammatory once it comes out of the fish. I don't know if you've heard that. Dr. Pompa talks about this.
I think again, we have to go to experience. I was off my fish oil for the last week. I ran out. I used the Nordic Naturals 3 grams of the Pro 2000, which is 1,000 milligrams of the straight omega-3s. And I usually do 3 capsules a day, and I probably should do more. Well, I ran out of them a week ago, and I have bone-on-bone arthritis, and it's usually quite manageable. I've got some shots in my knees, and it's usually quite manageable. Well, as this week has increased, my general inflammation and body pain and my knee and leg pain increased to the point where I actually had to start taking ibuprofen to manage it. And it was like, what has changed? I went off my fish oil a week ago. That's what changed. So I do not believe that most fish oil becomes pro-inflammatory. I mean, especially since it is a precursor to your PGE3, which is anti-inflammatory. And of all of the role that the omega-3s, we need the DHA and the EPA actually in brain function, both for the Krebs cycle to get in your, all your membranes require DHA. So we can, only get our EPA from food. Yes, we can make the DHA from EPA if those pathways are working well, but in many, many people, they aren't working well. So, this is actually where I also like testing, both Quest and LabCorp. You can do a test of your fatty acids, and Dr. Umhau can jump in here as well, since he's an expert on omega-3 fatty acid research. But you can do you can actually look at your essential fatty acid profile and look at the relationship between your omega-3s and your omega-6s, and are the omega-6s turning into GLA, gamma-linolenic acid, effectively, and what's the ratio between your, DHA, your EPA, your arachidonic acid, etc. This is very helpful to know whether or not you need and to what degree you need extra omega-3 supplementation. And then there's the research. Yeah, John, do you want to jump
Yeah, well,
in?
the fascinating thing about omega-6 is that it's in a really reciprocal relationship, in effect, with omega-3. So they're so similar molecules. They're such similar places where they go into the body for the purposes of reducing or increasing inflammation. So if you've got a typical American diet, your excess omega-6 really swamps the receptors with this omega-6, and there you get more inflammatory prostaglandins and so forth. And that's probably what Christina was experiencing. Her body as an American is full of omega-6. Mine's full of omega-6. Well, actually, I've been eating um, probably about 10 grams, maybe 5 or 10 grams of grams, not milligrams, but
Right.
grams of omega-3 for the last decade or so, since I started doing my research. So I'm more like Japanese. So if you're Japanese, I could sample your muscle or your tissue anywhere, and I could detect that you're a fish eater and compare it to an American. The important thing about omega-3 is they have so many different functions in our body. You can get a real rapid response, which is probably related to the inflammatory effect on the gut wall and the vagus and the microbiome, because the omega-6s versus the omega-3s create a very different microbiome environment. The omega-3s will produce the butyrate producing bacteria, and you get the changes in the brain from the BDNF that's stimulated by the omega-3 created butyrate. But anyway, to get to your question, my friend, former colleague, Chris Ramsden, did a study looking at headache pain, and he was able to reduce headache pain only by reducing the omega-6. So if somebody doesn't eat fish, say it's critical that you monitor how much um, omega-6 you get. If you're not eating omega-3, pardon me, if you're not eating omega-3, you really can get a sort of similar effect by reducing your corn, soy, of course, and any animals that eat that food. And his diet even really eliminated walnuts because it reduced because there's so much omega-6. But basically, there's a yin yang sort of a thing with omega-6 and 3s. I give my patients higher doses than anybody I know because they get an effect instantly and stop drinking sometimes just on that one intervention.
What
And
dose?
yeah. What dose, John?
Well, it's a dose that's I pulled from Dr. Stoll's study in 1998 or 99, where he gave bipolar patients 9.6 grams of EPA plus DHA versus placebo in this really nice study at Harvard. And it was a small study, but uh, basically everybody that got the fish oil stayed out of the hospital, and 60% of the people that got the placebo relapsed to hospitalization for their bipolar mania and serious consequences within 3 months. So it's a huge effect, small study, but in the wisdom of our industrial medical complex, that study has never been replicated. Nobody's bothered to replicate it because you can't make any money off of it. But it's extremely powerful for stabilizing moods.
Well, it is. And then we have the research by Dr. Michael Lewis on using that dose and maybe even higher for traumatic brain injury,
Right.
for concussion, both preventing it and reducing it. We have his study in 2011 on that when he looked at the blood of soldiers who had died of suicide, that their omega-3 levels were profoundly low. But given that this is a discussion on psychotropic medication, fish oil has been shown to significantly reduce the number of electrical brain zaps that people experience when they come off their medication too quickly. And that this is a very important tool in our arsenal for that specific symptom, along with GABA. And I think, and John, would this be correct, that it's because it helps stabilize the neuronal membrane?
Well, that's certainly one of the things that it does. When I first did my research, I did a PET scan looking at the brain uptake of DHA. And at the time, the theory was, well, you take more fish oil and it changes the membrane, they're more fluid and more stabilized membranes and receptors. But the effect on that, and so that's one of the mechanisms that can happen. However, the effect sometimes is so rapid that can't be the only mechanism. One of the fascinating things about fish oil is that the half-life in the brain and in other adipose tissues is 2.5 years or 3 years. So once you start on this high fish oil diet, you've got a decade before you really max out the benefits for your body.
Well, I know that when I first went on fish oil 30 odd years ago, 3 days after going on, I think it was 4 grams, and I don't know the quality of the fish oil 30 years ago, okay, or the dose of it. All I know is that when I went on 4 capsules a day, within 3 days, the sun came out. My mood was brighter, my energy was brighter, everything was brighter within 3 days of going on the fish oil.
Well, what's remarkable about the omega-6 DHA, omega-3 DHA is that the brain contains, my estimate, about 40 grams. So the amount of these other nutrients that we're talking about are not rate limited. The only way you can get the DHA is you have to eat the fish, basically, or metabolize it. So if you're deficient in DHA in your diet, or if you're a heavy drinker, your brain is going to be unable to keep up its volume. And that's why we get this brain atrophy, I think, in alcoholism. You have these shrunken brains and people can't follow directions. I've had people just kind of wake up when you give them enough DHA, so their brain can start to grow back again and get resolution of this brain atrophy that's so commonly part of the alcohol story.
Mm-hmm. And we can get the DHA from blue green algae as well.
Right, you
So,
can, but it's so expensive.
It is.
Right.
It is. But we've got some vegans who just say, no, I can't eat fish. And we have people, like my husband, who
Right.
will not touch fish with a, 100-foot pole. So you got to kind of go around the edges here. But this is where the fish oil, I think, or a good omega-3 source, is crucial in supporting people off these psychiatric medications, because again, we have to go to the source of the psychiatric symptoms. And when you're looking at the actual sort of inside the brain, right, what are we looking at? We want to be supporting mitochondrial function. And we do that both with nutrients, and maybe if we're so insulin resistant, we may have to go keto for a period of time, but at least getting those key mitochondrial nutrients in there, right? We have to be feeding the neuron membrane, and remember that all the membranes have a similar fatty acid profile. So we're talking about the organelles, the vesicles, the whole thing need enough cholesterol. If we don't even get enough cholesterol from our food, the cell has to work extra hard to make cholesterol. Every single cell makes cholesterol. So we need enough cholesterol. We know, we've seen study after study with people with very low cholesterol levels tend to have a much higher rate of depression and even suicide. So we've got to make sure that the fatty acid composition is there. Okay? We've got to make sure that not only do we have the nutrients for mitochondrial function, but we have the nutrients for the cofactors for your neurotransmitter production. And that, of course, requires, your vitamins, minerals, etc., but also your amino acids, both targeted as well as from a high protein diet. We have to make sure the blood sugar is stable because we've seen, the psychiatric studies, neuropsychiatric studies that Dr. Salzer was doing in 1966, showing the number of serious psychiatric symptoms that came from unstable blood sugar. So we have to make sure that that's in place. Then we have to make sure that inflammation is decreased because of all the research that's showing that inflammation interferes with all the above things I just mentioned, right? And that inflammation can interfere with many of the processes in the body, whether it be the methylation process or et cetera, right? And how we need to be looking at, if we have this capacity, inflammatory markers. What is the interleukin 6? There's been a very strong correlation between high interleukin 6 levels and depression. What are the homocysteine markers, right? What are all these other markers that can give us an indication of how severely inflammation could be driving symptoms and therefore getting in the way of a taper process and a detoxification process? And then, of course, we need to look at what the environmental factors are that can be driving toxicity, driving inflammation, driving malnutrition, driving. So this is where we move into the lifestyle elements. How are you living your life? Are you trying to get some movement every day? Are you trying to optimize your sleep? And do you have good sleep hygiene? Right? Are you getting out into the sunlight at least 20 minutes a day, if not several hours a day? Are you trying to do fun things? Yes, when we've got anhedonia, right, from reward deficiency syndrome, or it's really hard to want to do fun things. And yet doing fun things can start this upward spiral. And using mindfulness to enjoy the fun things, to notice that we're enjoying them. So this is the whole functional nutrition approach to mental health, which of course is crucial when you are supporting somebody and coming off their psych meds. Other questions, comments, or stories?
I just wanted to mention for anybody here in this large group who's more new to this, Christina's nonprofit called eatingproteinSavesLives.org. I'll put it in the chat. I host a weekly free Zoom meeting every Wednesday. It's actually 8 p.m. Eastern Time, 5 p.m. my time, Pacific Time, on the 6 elements and an overview of what we're talking about here. So I will put that info in the chat.
Thank you, Elena. Yes, we're very grateful to Elena and Amy McDonald for hosting these meetings called
And
Amy, yeah.
Not as grateful as I am for you, Christina.
Well, I'm grateful because I can't do it all.
And that's
these
right. That
meetings
is right.
are a way to support people in their own recovery. It's an opportunity for people to come together weekly to look at what's working in their lives in terms of lifestyle and dietary changes, where they need to up their practice, getting support, getting ideas, getting tips. So this is where the rubber meets the road. And more power to you, Elena.
Can I comment, Christina?
Yes.
Okay, quickly. So much. I'm just so grateful to listen to you speak again, and also for John, your comments on omegas. And I was at the Feeding Recovery Conference, and I speaking to Dr. Cass, and we did my test on the omega 3 to 6 balance. And she, was promoting the Zinzino fish oil, which I started taking, and it's the liquid. And my test came back 16 to 3, which I was shocked because I've been in recovery for 28 years. Yes, I've had a lot of different issues and also chronic inflammation. And I've been taking Carlson's cod liver oil. I've been taking Nordic. I've been taking all kinds of fish oils for years. And I was shocked by that 16 to 3. I also was taking borage oil for the pyroluria. So anyway, I started on the Zinzino. My inflammation dropped by, I would say, like 60%. And it really shocked me because it is got the olive oil in it too, and it's liquid. So I think the absorption rate was so much higher. And then I ran out. So like you, Christina, I ran out and I went back on the CAP 3000 of the cod liver, and I cut the borage in half. And the inflammation came back. So I've reordered the Zinzino because I think that the absorption and the quality was really, really something for me. So it's interesting. In my practice, I've been putting a lot of people, I work with alcoholics, mostly in the 12-step community. As soon as you put them on omegas, they brighten up with the cofactor support. So they're not always willing to go to the aminos, but just having the cofactors in the fish oil has been amazing. And also, Elena, you're inspiring me to actually get my feeding recovery meeting going. So I've been working on that, and just really grateful for this discussion, and nice to see you again, Christina.
Lori, can you write that in the chat, the name of the oil you use?
Yeah, I'll put it in. They've done quite a bit of research that shows not so much the anti-inflammatory effect, but that when your fish oil is processed to get rid of the heavy metals, you lose the polyphenols. And when you lose the polyphenols, it apparently impacts the absorption rate. And so they bring in olive oil as a source of polyphenols to support everything. And, that they have very good research results. So it's certainly a company worth exploring. I do wonder if you include olive oil with your fish oil, if that doesn't do the same thing, but who am I? I don't know. Anyway, we're at the top of the hour. We can certainly go longer if we want to, but any further questions? I know we have success stories in this community. Okay, so I'd love to hear them if we have them. Otherwise, any further questions or comments?
I just wanted to say I really appreciate you, Christina. I know that this is Kathy speaking. Anyways, I know that amino acid and everything that you're doing is the path, and today's conversation is so important for me because my son is on so many psych meds right now. And I just feel like I don't know how to help him, in so many ways. But I really appreciate Carla and how you put into step by step what protocol. And then I'm curious about Dr. John, whether you're a psychiatrist or MD or where you're located, because I really, really need help for my son. He's on just so many psych meds.
Well, yes, but Kathy, you've done every single thing under the sun. The problem is your son is unwilling to stick to a clean diet. Your son keeps sabotaging himself no matter what you do. So I don't think the problem is your lack of resources, because you are one of the best mothers I know to find resources out there, but he keeps sabotaging you and himself by not being able to, by
This is
not being
where
able to stick
I'm-
to a toxin-free diet.
This is where I'm curious, I guess, maybe from a psychotherapy and trauma perspective. And also, like I'm working with Dr. Palmer, Dr. Chris Palmer, but his tool mainly is the ketogenic diet. And he did say, he said, it's not your son's fault. He said, Christopher, it's not your fault. Those meds that you're
Right.
on really make you crave sugars and carbs. So as much medication as he is on, the clinic, you know, his clinic and everybody else is surprised how quote unquote like functional he is. So I am giving him stuff. I'm
Mhm.
giving him, you know, minimally what I know what to give him. I just don't know the step by step, you know, exactly and the blood testing and, you know, just doing it really, really thorough. So I need, you know, that support. So I would love to connect with Carla.
Okay,
and
Kathy,
Sharon.
Kathy, why don't you call me again?
I will.
Let's set up an appointment and let's recreate his protocol, okay?
I will. I will.
And I will lead you through it step by step.
Yes. Thank you so much.
So I'll just say one thing I like to tell people. If people are on SSRIs, there are certain people who that helps, but there are other people that makes them drink more. And there's placebo-controlled double-blind studies that show that citalopram and escitalopram make people drink more. So they could switch off to something like a Remeron or mirtazapine, you know, and their psychiatrists could look it up and see it and switch them off. That may help that. The other thing about fish oil is that you know you'll hear people say it's risky because it can cause a heart arrhythmia. It's possible. I think it's certainly possible, but I would suggest that it's probably a risk-benefit analysis. And you can always eat fish. I always recommend first that people eat fish every day. That you get the same thing by eating salmon 3 times a day as eating a handful of omega-3. So
Yeah, my son's on SNRIs and he's on really heavy dose. So that's why I feel like it's complex. It's
yeah,
very complex
SSRIs are the
Yeah,
ones
he
that
was not on such a heavy dose a year ago.
because he jumped off his
So
cycle.
I'm sorry that,
And then now
huh?
because he jumped off his psych meds and
Uh-huh.
a psychiatrist in the hospital gave him a really, really heavy duty dose.
Oh.
Yeah, you can see it in the chat. And so I really